Welcome back, everybody, to the HealthU Watch, brought to you by Alaska Regional Hospital. We're here again at Sunshine Community Health Clinic, and we're talking today to Sarah, who is a licensed clinical social worker. I can't believe I remember that. That was crazy.
Good job.
We're talking about drug addiction and their behavioral health side of their business. And what's in the bag, Sarah?
So this is a heroin or opioid overdose response kit. I don't know if you are aware, but the state of Alaska declared the opioid epidemic a public health emergency in 2017.
I was not aware of that.
And we have, unfortunately, especially over the last year and a half with COVID, seen more fatal overdoses and more overdoses presenting to the emergency room. So the state of Alaska, through Project Hope, is very generous in providing things called Narcan kits, which are these fun little nasal sprays that can reverse an opioid overdose. So these are available at our clinics. We want to really encourage anybody that may have any reason to ever use one of these to have a kit available. If you suspect somebody has overdosed on any type of opioid, prescription or otherwise, don't want to forget someone that's prescribed medication could unintentionally overdose, or that medication gets in the hands of somebody else. And if they have overdosed, you can use this nasal spray, puff in a nostril, and the medication that is in Narcan is naloxone. It is a medication that preferentially binds to the opioid receptors, which is a fancy way of saying it will kick the medication off that is causing the overdose and replace it with this. So it will reverse the effects of that overdose for that individual. It's not a replacement for emergency medical attention. You still need to call 911, still need to get somebody to the hospital when that happens, but it will keep somebody alive long enough to get that emergency medical attention. Little kit like this comes with two, so if the first one doesn't work, you can give a second one. The other really cool thing about these is they don't hurt you if you have not had any opioids in your system.
Oh, so I could just shoot one in my nose and it wouldn't
You could do it right now, it wouldn't hurt you. If you had overdosed on a different substance, it won't do anything, but it won't hurt you, as well as if somebody's having a medical emergency of a different reason.
So these are free at your clinic?
They are.
You guys are giving them away?
Correct.
So, okay, so this is close to my heart because I've had friends and family who have suffered from addiction and have passed away from overdosing. What do you do when somebody is addicted? Like, is there things that you guys provide that come before you have to use the Narcan? Is there things we can do to help get them help with the addiction?
Absolutely. So Sunshine Clinic also has an office-based opioid treatment program, which is a long way of saying that we have a Suboxone program. Okay. And that program is a combination of both medication-assisted treatment with Suboxone as well as counseling. It is available at all three of our clinic locations. So if someone or someone's loved one is struggling with any type of substance use disorder, we really encourage them to reach out. Our Suboxone program is specific to people that want to use Suboxone for an opioid use disorder, but we do have other group and individual treatment for people struggling with substance use of any sort, alcohol, meth, or any combination.
That's great. And you don't have to be in person. These can be done, you guys can do a lot of this via remote, over the phone, slash, what do you call it, video?
Yes. So we can do a lot of our services via telehealth.
That's the word I was looking for.
We do require a little bit more of an in-person component for our Suboxone program, simply because we're doing drug screens and making sure that those levels of Suboxone are appropriate, and making sure they get some face-to-face medical care with that as well. But everything is flexible. We're here to serve people. So if people are uncertain or have questions or don't know if they fit into the bubble of what we provide, we always encourage you, just call us. We'll talk through it. If we're not the ones that best serve you, then we get you connected to who does.
That's fantastic. So if you guys know anybody who's suffering from addiction or you think might be addicted, make sure that you get the help they need. Sunshine Community Health Clinic is here to help. Go to their website, give them a call, make an appointment. They're fantastic. So yeah, this is all really great information. If you were to leave our listeners with one last thing, what would it be?
So many things. What I would say, particularly for anybody that is a loved one of someone experiencing any substance use disorder, to take away the idea that there is no right answer in how to help someone. I think we get really stuck on thinking that, well, if I did more of this or I did less of this, and there just isn't a right one. If there was, I would tell you, and it would be a whole lot easier for all of us, but the reality is it's really complicated.
Yes, and I'm sure there's a lot of conversation to be had around mental health and how that plays into addiction. We don't have time for that today, but I think there's a lot of resources on your guys' website again.
Absolutely.
And if you guys reach out to Sunshine
Community Health Center.
Community Health Center. God, that's a mouthful.
It is. Or Sunshine Clinic.
Yeah, or Sunshine Clinic. That's easier for me. So reach out to Sunshine Clinic and get the help you need, and for you or your loved ones. Thank you so much again for being here, guys. To sign up for the prize giveaway this week, make sure you get the secret phrase. Click the link in the caption. Put that secret phrase in to be entered to win the prize. You got a good chance of winning. And thanks again for tuning in from HealthU Watch, brought to you by Alaska Regional Hospital. We'll see you next time. Thanks, guys.